Hello everyone, my name is Corey Dillow. I'm a licensed acupuncturist and massage therapist. And today I'm going to be speaking about dry needling and its relation to classical acupuncture sources. I think that this is a topic that really deserves closer attention and investigation. And I think there is currently a lot of misinformation regarding this topic, and also a lack of access to information, especially historical acupuncture sources. There's really very little that has been translated into English regarding this subject. So I'm hoping to bring some of those sources to people's attention today and create some access. This will be a brief lecture. Each of these topics can really form kind of a comprehensive lecture topic. So today I'm just really trying to distill it down to some key sources, key points, key ideas, and so on. Most of the research I'm referencing today in terms of the Chinese source materials comes from Professor Huang Longshang's research and analysis. He is a modern researcher, still researching today, and his expertise is really on the historical development of acupuncture, acupuncture literature and its historical transmission, and acupuncture theory. He's an incredibly well-rounded researcher, and I think his work really deserves a lot more attention. So that's where we'll be starting today. And so in today's discussion, I'll mostly be working with the Trigger Point Manual, 3rd edition, Huang Longshang's exploratory discoveries and rediscoveries of human morphological structures beneath the fingertips and the needle tip, and Huang Longshang's evolution of sinew disease needling methods and the rise and decline of Jing-Jin theory. All of these are tremendous sources. The latter two articles have not been translated into English, but for any of you that can access Chinese source materials, these are really great articles. Okay, so in today's talk, we're going to look at and define trigger points and dry needling. Of course, we need to know what definitions we're working with here. And then we're going to take a look at classical anatomical terminology. I feel like this is a subject that is really lacking in its resources in English. So this is really important to explore. Of course, general pathological terminology in relation to Chinese medicine. And so we need to identify what it is we're locating and needling into, and then I think we'll see a closer correlation to something like trigger points. So we need to look into that. Then we need to take a look at what is kind of the primary intramuscular needling technique in early source materials, and define that more closely. And then further, we're going to see examples of how these kinds of needling methods are utilized historically and explained in some of the terminology they're using. And then I think, with all of this being said, we'll get a clearer idea of this relationship between dry needling, trigger points, and what was actually occurring historically in acupuncture source materials. Okay, so first we needed to define myofascial trigger points. And so we're going to use the Myofascial Pain and Dysfunction Trigger Point Manual to do this. But these are sites that are pathological change oriented. that form kind of a palpable taut band that can be palpated with cross fiber, flat, or pincer palpation. They can form hypersensitive spots or locations within a taut band of tissue. And so this second one is actually really important because even in classical acupuncture materials, it's not just identifying a location of pain, as we'll see. It's actually you are aligning pain with perceivable changes in tissue. So we'll get into that more, but that's a very important notion. And so stimulating these sites may produce a local twitch response. They may produce motor and autonomic phenomena. And so, again, that could be like a muscle twitch response. This could be inhibition or weakening of that muscle, range of motion problems. There might be kind of changes in complexion when locating one of these sites. There could be changes in kind of the skin in terms of formation of like goosebumps or changes in sweating. So that there are a number of kind of changes that can occur with these kinds of sites in terms of their pathological presentation and their palpation in clinic. And so, kind of as I just explained, may prevent full lengthening of the muscle. It can restrict range of motion and may cause inhibition and weakness of the muscle. And so, when dry needling is applied to such sites, obviously you need to kind of palpate and identify the necessary anatomical landmarks of what you're working on. And then you're looking at this, locating this taut band to identify the trigger point within it. And then you might manually kind of fixate it to keep it from moving or disappearing underneath your fingers and your needle as you're working on it. And so there are different kind of types of grip or methods to kind of fixate this site. And different methods will work better on different muscle structures or different body areas. And so, as far as the needling technique goes, you might needle kind of straight in or out, this kind of like lift and thrust, as we might call it as far as an acupuncture technique, sometimes sparrow pecking. There are a number of acupuncture techniques that could correlate to this. We're going to discuss two particular ones that I did not mention yet going forward. But kind of in these sites, you may draw the needle back kind of to the surface layer and redirect it to try and find and treat other trigger points that are nearby. So there's this redirecting of the needle, and we'll see that that's important actually for a future technique we'll discuss here. After removing the needle, one might press to try and prevent bleeding or hematoma or something like this. And afterwards, you might kind of apply some manual massage or something to try and reduce soreness from treatment. And so kind of localizing this trigger point is mainly done by palpation, but you're also using visual and perhaps verbal cues to determine like if you've really found something. And so, this mentions patient expression, their facial expression may change. They might, clench or have some kind of involuntary response, based on what you're palpating. And essentially, the better you are at locating these sites, the more efficacious your treatment will be. And so here, they specify, like, you're not just kind of blindly palpating and needling an area of diffuse pain. You're trying to also relate this pain to change in tissue. So this might help you kind of distinguish, from an area of referred pain in kind of the more like the sort of like true, as we'll say later, but kind of the true pain location. And so again, these sites need to be sort of manually held in place in certain instances, so that you're kind of staying in contact with what it is you're trying to needle, and not losing it halfway through. And so I found this statement here to be pretty in line with the sentiment of acupuncturists, but the needle should be considered as an extension of the clinician's finger. The clinician therefore palpates the trigger point with the tip of the needle and penetrates it. So yeah, this kind of sentiment is commonly echoed on behalf of acupuncturists, because it is definitely a test of one's awareness, not only in the palpation process, but in terms of kind of end feel on the needle, like what is happening under the tip of the needle as you're working, and what are the sort of changes in density and texture and so on as you're kind of locating inside the body what it is you're after. And so jump sign here, we've just kind of spoken about this, but this is kind of the clinical term for eliciting this kind of involuntary response in the patient as you're palpating and trying to locate this myofascial trigger point. And so along with jump sign, there's also a shout sign. And so that might be, a more verbal exclamation on behalf of the patient as you're locating this site. And so, yes, in some places this is more reliably or more easily created, and in some muscle structures it's a little more difficult to produce this. But yeah, that's something that's discussed more in the trigger point manual according to different locations. All right, so now we're going to kind of delve into the Chinese source materials here. And this is a bit more of my expertise personally. I wanted to include some basic definitions of myofascial trigger points, of dry needling, so that we can compare and contrast that to kind of the classical acupuncture sources, so that we have some kind of definition in our mind as we're going through that, to kind of see how similar are they, or where is their overlap. But I certainly have colleagues that could go into much more depth on dry needling itself, but this is a bit more of my expertise. And so we're going to start with this idea of the 5 body constituents, and their formation kind of into body systems and clinical frameworks. And so this model basically takes these kind of main anatomical structures that can be assessed and accessed with a needle and treated, and kind of uses this to sort of summarize human anatomy in a way. And so you have skin, you have flesh, and here roe or flesh, it's really referring to the musculature. So you might see this kind of described as the red flesh, for instance. and jin, sinew or tendon in this context it can refer to. But we'll see that actually there's a lot of interplay between this ro and jin, not only in terms of like the relationship between muscle and tendon or sinew, but in terms of them kind of being used interchangeably in some instances, and one of them actually sort of like taking on the meaning of the other and kind of forming a more composite structure. So we'll look at that soon as well. And of course we have bone, and we have vessels, which may incorporate the vessels that pulsate, arterial structures, or vessels that do not, more venous structures. And then you'll notice that there's a sixth here. This is not kind of explicitly a part of the 5-body constituent model, but it's actually involved in it as a sort of link or mediator sort of between these structures. And so, we'll see with certain, needling techniques in the Neijing that, although there might be sinew disease, for instance, that it actually they, in some instances, are targeting the membrane of the musculature, to treat it. And that's a historical needling category called 分次, this division needling. And I actually just did a lecture on that through the Academy of Source-Based Medicine with Ivan Zavala, where I went pretty deep into not only probably close to 24 anatomical terms like this, but also into this specific needling method, which it's really a myofascial needling method, found in early writing, and it gets kind of quite extensive use in this writing. But that's not our focus for today. And so if we look at these body constituents, as I said, they each are structures that can sort of be accessed in clinic and assessed in clinic. And that's why they're emphasized. And so through the assessment practices of these body constituents, and the needling methods that develop in relation to them, they start to form kind of clinical frameworks. And of course, as the understanding of each of these structures improves clinically, their domain sort of expands as well. And there's more and more detail about what's going on with these structures. And so, as we'll see, for instance, the skin becomes what are called the pibu, or skin regions. And so these are sort of regions of the skin following the mai, or jingmai actually, which we'll talk about in a second, as they sort of display pathological response. And we'll see that, again, Ro and Jin, they sort of start to form a composite, and these get made into what are called Jingjin, usually translated as like kind of the sinew channels. I really don't think channel is a good word in that context specifically. This term Jing, it's kind of loaded in a way, because it's conveying multiple things kind of simultaneously. So it's hard to translate into English for that reason. But Jing can refer to, so it's originally actually a hydrological term. And kind of larger sort of main bodies of water, for instance, take on this kind of term. And so it is something that can distinguish something from by its size. And so not only size, but also sort of orientation. So something that is vertical or sort of like longitudinal in nature may take on this on. So a large body of water that sort of traverses the earth and defines a territory, perhaps might kind of take on this term jing. And so the vessels, of course, the blood vessels take on this kind of nomenclature from hydrology. And so the large, sort of vertically or longitudinally oriented vessels may be called jing. And so the sinews, or jing jing, as they are sort of oriented in a vertical or longitudinal way, and are formed into a larger composite unit, they kind of get that nomenclature. So channel is just kind of weird in that particular context of jing, but I think the other sort of definitions become more pertinent. And also this term jing can suggest something that has been regularized or standardized. And so as you're taking these kind of body constituents and forming them into some kind of framework that is to be standardized, jing also becomes a good term to describe that. So yeah, this is that kind of loaded meaning I'm talking about here. And so or vessels, as they are explored clinically through the practice of vessel examination, and again including both pulse and venous inspection, are made into clinical frameworks. And so this is also where the meridians or channels or jingmai come from. They are constructs devised out of the clinical experience of vessel examination. I have a book that I've spent the last several years translating, and it conveys some of Huang Longsheng's research on this subject as to how channel theory was developed, how that concept or idea came to be, and describes a lot of this process of vessel examination and its role in the development of this kind of clinical framework or construct or concept. Okay. And so for each of these tissue layers or body constituents, there are needling methods that I mentioned, right? And so this is kind of acupuncture's early target tissue techniques. You've got techniques specifically devised for the skin and actually the subcutaneous space that the skin and kind of the muscle share in a way. But you have techniques designed for those layers. You've got techniques designed for the musculature and sinew. You've got techniques devised for the bones and vessels, right? And as I said, because the membranes sort of like form an interplay amongst these structures, there are techniques that are also stimulating those membranes on behalf of these other structures. And so we get this, what is called Wu Ti Si Fa, and excuse me if I got the tones wrong there, but this 5 body constituent needling methods. And so yeah, this is really acupuncture's sort of early target tissue techniques. Lingshu chapter 7 contains a lot of them. So just looking through that chapter, you'll already see lots of target tissue techniques that exist. Okay, and so because we are discussing myofascial trigger points and dry needling, we need to kind of explain a little bit more about that anatomy. And so this term sinew or jin has both broad and narrow definitions, okay? And so in a narrow sense, it's more about kind of tendinous attachments or kind of attaching structures. And you see this usage come about, especially when this sinew term is juxtaposed to bones, joints, and juxtaposed to this muscle or rou term. So when it's kind of used in relation to those, it's taking on more of this meaning of this kind of attaching structure. When it's used in a broad sense, it's not only describing those attaching structures that we just mentioned, but it's also describing the musculature and the membranes that surround that musculature. So fascia. And so it becomes a term that describes kind of this composite unit of structures. Again, of this membrane, muscle, and their attaching structures. And so as that composite structure is described in relation to its sort of functional relationships, pathological change, in terms of how those structures link to one another and traverse the body in this sort of longitudinal or vertical manner, this is where you get that sinew pathway or jing that we just discussed in the last slide. And when we're looking at the membranes that surround the muscle in particular, this term mo and huang are used. And so these are the sort of membranous structures that are wrapping kind of the muscle and tendon, and actually elsewhere as well. That are sort of situated between the skin and muscle. It can describe kind of deep abdominal structures. So they kind of use it in different capacities. And so we'll get into the definition of that a little more in a second. Now, there's another term that has both anatomical and pathological relevance. And so this is another sort of term that gets a little mixed up. But this jie can refer to sites where the tendons attach, where those attaching structures attach, and this can be looked at as like a binding site. But jie can also refer to pathological change in the muscle. So we'll save that, but it can refer to a pathological change in muscle structure as well. We'll define that a little more as we go. Okay, and so to discuss this more, or membrane term a little bit more, I think people are kind of surprised that this one is discussed. I've definitely encountered people that didn't believe it for some reason, but we'll take you back to Eastern Han Dynasty. It was described earlier than that, but this is kind of one of the earlier dictionaries, the Shuowen Jiezi, explanation of simple graphs and complex characters. And so in that dictionary, we already have a very clear definition of this, and that is the mo are the membranes between or among the flesh or muscle. So they're giving you an anatomical definition there. And then further, we get mo are the thin film that lines and envelops the flesh or muscle. And this is actually a sort of like commentator within that dictionary, just explaining further what this original definition meant. And so they're being very clear here that this is kind of that thin film that sort of lines and surrounds, envelops the muscle structure. And so then we can kind of go a little towards the Tang Dynasty here. And Yang Shang Shen in the Taisu, which is the earliest sort of commentary and edition of the Neijing that we have. But he gives a few definitions that are really helpful for us. And he says that Mojin, and so Mojin is mentioned in the last slide, by the way, but this is that membrane and sinew character together. You'll see that the order kind of flips depending on the time or person using the term, but they both refer to essentially the same thing. So we see that the Mojin of the 12 sinew pathways together, so the Mojin refer to the 12 sinew pathways together with the membranous structures on their outer aspect that envelop and partition the flesh or muscle. This is termed Mojin. So yeah, this is kind of directly referring to that more composite view of Jin that we had just spoke about, that includes this sort of membranous component. And so further, membranes or mo are the sinew of membranous flesh located beneath the skin and above the muscle. So they're kind of giving you an orientation for it. And then there's this term rou huang, or flesh huang. Remember, huang is a type of membrane. And again, these are the membranes sort of below the skin and above the muscle. And so, kind of like I said, this like Jin and Rou, sometimes they're distinct, and sometimes they sort of overlap with one another. And in some instances, you see Jin sort of replacing Rou for this more aggregative or composite structure. Okay, and when we're looking at the pathology of muscle structure in general, we kind of get two broad categories. We get Jinji, the sinew tension. It's an abnormal state of tension or hypertonicity. And then Jinzong, sinew flaccidity. And that's just the opposite. It's a lack of tone. It can be present in hemiplegia or paralysis and other kinds of things. Today, the one we're focusing on is the sinew tension, or Jinji. And so again, that's kind of a hypertonic state of the tissue. And this kind of term can act as an umbrella term for different specific states of hypertonicity: spasm, cramping, inability to flex and extend, and so on. Like convulsion convulsion disorders can kind of fall into this. And so there are more specific terms that can kind of fall under this umbrella. And so if we look into the Hanyu Da Sidian, this big dictionary in Chinese medicine, it says a disease term in Chinese medicine. It is characterized by contraction and tension of the sinews in vessels. Vessels also, especially the arteries, also have change in tone, right? So the vessel can constrict or dilate and so on. So and there's a loss of flexibility resulting in impaired flexion and extension. It commonly arises in those with underlying constitutional deficiency who are exposed to cold and wind, or from blood deficiency and depletion of fluids leading to malnourishment of the vessels or sinews, right? It can be seen in tetanus, convulsive disorders, impediment, infantile wind, which I think is kind of like an infantile epilepsy. I'd have to look at that to be sure, but I think that's what that is. And so, anyways, this sinew tension is kind of an umbrella term, okay? And so next we have this jiejin. And so this is a term that I had started to describe a few slides ago. And this jie, again, can be an anatomical feature where it's referring to kind of an attachment or sort of binding site of the tendons or, those sinuous structures. But in this case, we're referring to it as a pathological term. And so jiejin, or knotted or bound jie, can mean sinew, refers to a hard, knot-like nodule or band that is usually accompanied with pain. And so this is kind of a statement sort of describing that. This is actually the Jingjin chapter, sinew pathway chapter. And it says, wherever the sinews pass and form knots, there is pain and cramping. And so this is just kind of illustrating it as a pathological term. And this chapter uses it as both a pathological and anatomical term, so it can be a little confusing there. And so next we can look at another Sui dynasty writing called The Origins and Indicators of Disease. And it defines this type of pathological term. It says the sinew knots and gathers. This is called jiejin. And if we look at the Hanyu Dasidian definition of jie again, I think this kind of illustrates the image a little better, but it says to twist or bind a strip-like material into a lump or knot in order to make an odd object using this method. And so we can kind of imagine, this muscle fiber that's sort of being like bound into a tense and sort of knotted-like appearance or palpable formation. So now that we've learned just a little bit about the anatomical terminology, we can clearly tell they're talking about muscles and tendons and membranes, essentially myofascia. Now that that's clear, and we have some sense that, okay, they're talking about actual changes in tone of these structures and certain tissue formations in response to pathology. Now we need to kind of look at the needling techniques involved, and this is the Neijing or inner canon's primary intramuscular technique, meaning that the needle is inserted into the muscle directly. Because that is in contrast to intermuscular needling, and the Neijing or inner canon also has this type of technique. And I described that earlier. It's called division needling or 分四, and that is kind of this subcutaneous needling below the skin, above the muscle. This is the needling kind of between muscle structures, essentially to treat the muscle from the standpoint of its membranous coating. And there are reasons for that. There are, there's not just discussion of the anatomy, but they also understand the role of physiology that these membranes have, both in sort of like fluid distribution and in the sort of immune response from a Wei Qi or defense Qi standpoint, in kind of allowing the distribution of circulatory structures and these kinds of things. So that's a whole nother topic. Again, I discussed that pretty in depth and at length in that Neijing Part 1 course through the Academy of Source-Based Medicine. So you can check that out if you're interested there. But yeah, we need to talk about this kind of intramuscular technique. And it's called 凡针解四. And so we're going to talk about 解四 first. And this kind of 劫 means to like rob or pillage or plunder or seize. It refers to a very kind of like forceful, to take something by force type of action. And so you can, tell that that's going to be a very sort of vigorous type of needling technique, okay? And so 解四, it's a forceful needling method in which the needle is driven into and actively manipulated at the most painful site of sinew contraction. And so, like in the dry needling slides earlier, we saw that you're not only locating a site of tension and contraction, but you're locating pain within that. And it doesn't really count as a myofascial trigger point, as far as I understand, if there is no tout band involved. Because then you don't kind of have this tissue change to identify whether it is this location that you've found that's painful is referred pain, or if there's some underlying like structural reason that you're trying to address, such as a myofascial trigger point. And so yes, this 解四 technique is occurring at the site of contraction in the most painful location within that contraction. And so next we need to kind of look at, well, then what is this 凡针that's mentioned? And because basically once you have done this kind of forceful direct needling method as described a second ago, then you are going to heat the needle while it's still inserted. So the handle or shaft or something like that. And so this 凡 character means to sort of burn or roast or set fire to something. And so you've gone in, you've stimulated this muscular contraction that's exquisitely painful, and then you are going to sort of heat the needle somehow while it's still in. And because this was because one of the primary sort of like pathological influences associated with this hypertonicity was overexposure to cold. And so heat, as we know, causes kind of more relaxation, expansion, movement, and so on. So you've got something to go in and sort of break that hypertonicity, and then you've got warmth coming in to kind of further soften it out. So that's this kind of combined needling method here. And in the Ming Dynasty, which is quite a bit later, we see Wu Kun in his annotation of the Inner Can, Inner Neijing, describe exactly that. He says, as for burning needle, after inserting the needle, use fire to burn it so that it becomes warm. It does not need to be heated until it becomes red. And this is a different technique from fire needling, which is the heating of the needle until it's red hot, quick insertion and withdrawal. And so that's why you can see kind of the contrast in my translation here. I was kind of deciding between, all right, do I call this just warming needle based on interpretation of it, or do I go for burning needle, which is a little more true to the definition of fan. But now you kind of get the full gamut of that. Okay. And so here we have Dr. Xuan Zhiren, and he is kind of a more modern example of someone who sort of rediscovered and championed this kind of method, and actually, I'd say developed it further. And we'll see what I mean by that in a second. But Xuanzhiren's an interesting physician because he was an orthopedic surgeon first, who became an acupuncturist and further honed that skill set. And basically, as an orthopedic surgeon, he was finding that there were just a lot of conditions that weren't well addressed, solely through kind of this surgical or orthopedics lens. And he found that acupuncture had a lot of potential and promise kind of in this domain. And so, throughout his life, he developed a few different things, and one is called soft tissue surgery. And that's kind of an integration of his orthopedic surgery knowledge and acupuncture, right? He developed a style of Tuina and this silver needle therapy. And this silver needle therapy that he developed is essentially a rediscovery of this fan zhen jiezi. And so what he's doing is he's inserting multiple, thick silver needles where he's going in and kind of doing sparrow pecking at sort of the deeper, like bony attachment sites, or these like really sort of tender, tense sites, and eliciting, very prominent sensation. So soreness, distension, heaviness, almost like a numbing feeling. And then once those needles have reached that locus, he is then doing burning moxa on top of them. And he's using silver needles because they are more heat conductive, as far as I understand. And so he's got these kind of like special needles that are developed to be the most conductive to heat, and so that he can conduct heat into these kind of contracted, hyper irritable, sensitive locations. And so he's a good example of this sort of rediscovery of a technique like this. Okay. And so now I'm going to give you some historical examples of application of methods like this. And so this is coming from the Taisu. Again, this is kind of like a Sui to Tang dynasty commentary on the Neijing. Again, one of the kind of earliest versions of the Neijing that we have. So it's a very useful document for textual scholarship. Huanglongsheng refers to this a lot. But it says, if disease is located in the sinews, regulate it at the sinews. And interesting that they chose the word like tiao or regulate here, because it really is, you're trying to take something that's in a hypertonic state or state of tension and cause it to soften. So it's very apt. And then use this kind of fan zhen jiezi, this warming needle or burning needle, seizing needling kind of technique at the sites of tension. And so, again, we have this, target tissue-based technique lined up with the abnormal sort of change in that target tissue, using a technique that not only addresses that structure, but also addresses the mechanism of cold being involved. So it's sort of integrating all of these clinical levels together into a single kind of simple statement here. And so here we have another Tang Dynasty text, from Sun Simiao, this Qian Jin Fang or Qian Jin Yao Fang. And so this is this is the method that is kind of quoted most often, or most well known in English, I guess, source materials or classroom settings. And this is shi. And so the original statement says there is the method of shi. When a patient has pain, then pinch the area above that pain. If within it corresponds to the location, meaning there's kind of a match between the location and what you're finding by sort of pinching or manipulating the tissue of that site, then don't worry about like what the name of the point is or if it's a point. Or therapeutic site, I say, is better than the term point. There's a reason for that. It's that 学, the word we're sometimes using for point or translating to point, actually has a morphological identity to it. It's a cavity or a depression located between structures. Shu is another term for this. And so these kind of point-related terms actually have specific morphological basis. And that's, another lecture that we'll go into more. And that I believe Ivan is going to talk at length about that in our Neijing Part 2 class through the Academy of Source-Based Medicine. But yeah, that would require much more explanation. So yeah, I use therapeutic site because I think it's a little more inclusive there. But upon obtaining it, it immediately becomes painful. Thus the patient says, sure. And that kind of means like, that's it. That's the spot. And so in our dry needling slides before, again, we have palpation or manipulation of surface tissue. We have this kind of emphasis of pain once you've found the right location. We have this involuntary exclamation or shout sign that we had discussed. And all of these are kind of being described in this one little clinical process here. And so next, we have this Zhenjing Zhaiyingji, this Yuan Dynasty text. And in this statement, it says, in all cases of pain, do not immediately attack it. I mean, just don't just go exactly where the you think the pain is and just start needling. No, you've got to do a little more investigation. And he says, first you need to treat the true pain location. So what is the true pain location? How do we determine what that is? I think we'll discuss that a little more in the next one, but keep that in mind, this true pain location. This therapeutic site is called the naturally responsive site, or 田营穴. And so he is equating the true pain location and the naturally responsive location as kind of synonymous terms here. And when you perform this, it's essentially called the pain resolving needle. Yes. And so when needling is finished, use the hand to press and knead the area firmly. Then follow the associated pathway and needle relevant sites, and it will resolve. This is to say that kneading the location of pain causes it to disperse. Provisioning and defense circulate, and by needling it, recovery is rapid. So there's a lot going on in this one. But you're identifying this true pain location or naturally responsive site. And once you have needled that, you're applying kind of this post-treatment intervention to assist in the complete resolution and sort of improvement of efficacy of the technique. And also perhaps to eliminate some of the discomfort and soreness and to harmonize the circulation of that area is kind of what this is describing, this yin and wei. It's provisioning and defense. Okay. And so this is Qing Dynasty. It says, first, when treating widespread pain throughout the body, the patient must personally point out the location of pain. Like, they got to tell you where this hurts. And then using the fingernail of the thumb or index finger of the left hand, you press and sort of pinch and manipulate this location. If the patient clenches the teeth, grimaces, startles, or the color of their complexion changes, and if the pain is intolerable, then this is the non-fixed location therapeutic site or a naturally responsive site that was mentioned in the previous passage. Insert the needle with the right hand. If the pain is extreme upon insertion, it will certainly be effective. And so this is really lining up a lot of things for us here. And so not only is this true pain location, which is equated to this naturally responsive location, defined as a site that's palpated, that elicits involuntary response, like the jump sign that we discussed earlier in the lecture. It's also linked with kind of the response to needling, is that when you needle into this, there's also kind of an extreme sensation that occurs. And all of this together sort of allows you to determine the most efficacious location of treatment. And so not only did we get this kind of like change in expression or that kind of thing, but we also get kind of an autonomic response, which is like a change in the perfusion or of the complexion, right? So the complexion changes. Now we have actually a Korean writing from 1644 or Ming Dynasty or Joseon, Korea. I'm not sure if I pronounced that correctly, but for hypertonicity of the sinews and aching pain of the arm, the practitioner uses the left thumb to press firmly on the knotted sinew at the painful site so that its location does not shift. And so here you have a palpation method and this sort of like locking or trapping down of tissue, right? Then use a needle to apply penetrating needling or guanzi at the sinew knot. And so this guanzi or penetrating needling is really important. I should have probably had a dedicated slide for this, but this is a technique that is used to directly needle pathological lesions in tissue. And this can refer to kind of, it's not just sinew needling, but you can use it for other things too. It's just in this case, it's being used for sinew needling. And so you're penetrating into or through that lesion directly. And guanzi also has the caveat that once you've needled, you can redirect that needle in multiple ways to try and target further aspects of that lesion. And so this is another thing that was kind of directly described in the trigger point manual from the first few slides here. And so when the needle tip responds to the injured sinew, resulting in unbearable aching, this is the naturally responsive site again. Follow the locus of intolerable pain with the needle, and there will be miraculous effect. If not, needle again. In general, the needling of the various kind of cavities, points, therapeutic sites of the Jingluo, does not surpass this method. And so you have this imperial doctor, Hoem, from Korea, telling you that this is a more effective method than standard needling of points. So these kinds of needling methods were actually highly regarded at different points in history. And so I think there's often, the notion among acupuncturists that not only did this not exist for some reason, but that it's less effective and it's not true acupuncture. But as we're seeing, there are actually a lot of examples throughout history where very prominent physicians are advocating explicitly for this kind of needling method. And the fact that this kind of needling method can be rediscovered again in modern times and gain popularity because of its usefulness and practicality also says something about it, I think. So yeah, he's saying here that this is a more efficacious method than even just kind of needling points. Okay. And so this statement aligns the tense or nodular tissue with the site of pain. There's manual fixation of that tissue to sort of trap it in place so that you don't lose it. There's direct needling into the lesion. And there's also looking for the most sensitive location within this lesion. And needling multiple times if necessary. So this passage really encapsulates a lot of what was discussed in the opening slides from the trigger point manual. Okay. This is another one from Hoim, the Korean physician. For hypertonicity of the sinews of the leg with difficulty walking, use the rounded sharp needle to apply penetrating needling at 4 or 5 locations along the affected sinew. Have someone brace and assist the patient. If it is extended, flex it. If it is flexed, extend it. Taking recovery as the measure. The effect is miraculous. And so here, not only is there a specialized needle that they're using for this specific needling method, and in the Neijing and early acupuncture literature, like I said, once you kind of have these body constituents, you have the diagnosis that is developing, regarding them. You have treatment that's becoming involved, needling methods. They start to design needles that are specific to these tissue layers, the techniques, and actually in some cases preserving that structure so that it is not damaged in the treatment process. And so we get these specialized needles kind of formed around these kinds of clinical methods. And some of these methods are actually, again, kind of poorly understood or represented, but have become much more clear through this kind of extensive research effort that's been going on. And so, again, it's not the time and place to go into all of this. I think, again, Ivan might cover that in part 2 of our Neijing course that's coming up, sometime near the end of this year. But yeah, so you get a specialized selection of needles here. You get multiple treatments along the length of a single structure, because it's not always just one site in a structure. You might narrow it down to kind of the most reactive or most prominent site, but sometimes you need to treat multiple things. There's kind of post-treatment intervention, this flexion, extension, like trying to regain mobility of these structures. And, this also kind of, just clearly portrays that these kinds of changes in tone can kind of inhibit the proper lengthening or movement of these structures too. So we have a Ming Dynasty quote here. If the arm and elbow are in a state of contracted tension and cannot be extended, first use the hand to rub the area beside the elbow at both the medial and lateral sides where the sinews have tense and knotted gatherings. Then use the thumb to press firmly into the center of the knot without allowing it to move and incise it with a needle. I think what's going on here is that they're bleeding that nodular region. I'm not entirely sure though, this pose kind of technique. Next, along the inner elbow, above and below, palpate along that continuous sinew structure, and at 2 or 3 sites within it where there's nodular binding, apply this penetrating needling, guanzi. Similar needling may also be applied at the wrist where there is sinew contraction and nodular binding. In addition, apply heated bamboo cupping 3 or 4 times. Alternatively, if there is knotted congestion at the large vein of the elbow crease at cherza, needle it, and it will certainly be effective. And so here, again, we're kind of getting a bringing together of multiple elements here, but we get pre-treatment intervention, kind of like warming up the area. We get the identification of tense or nodular tissue. We get manual fixation of the tissue. We get more direct needling techniques. We get needling along a continuous structure. And we get the kind of integration of multiple therapies based on, to some extent, examination of that kind of structure. You know, the vessels being one of those body constituents, seeing a change in the, this large vein of that region and addressing it to regulate it. And so this last slide is an image that I got from the National Library Collection of Japan from 1865. And it is demonstrating this kind of needling process. I think that it, is often assumed that all Japanese needling, forever or what have you, would have been very gentle, shallow, non-insertive kinds of techniques, and unfortunately that's just not true. Or maybe fortunately, I like to think that there's a breadth to this medicine, but here we have a direct example of needling being performed on the trapezius, kind of like crossing the upper trapezius, kind of angling towards the in line with the clavicle, to kind of stay out of the way of that lung field. And we see the gentleman, we see on the left the hand kind of getting this pincer palpation grip, and we see the gentleman on the right kind of letting out possibly a shout sign here, and there's identification of the painful site and insertion of needles kind of through this tissue. And I will say as well, in my part in the Neijing 1 course, I cover needle techniques from a Japanese source from the Edo period by an author or school of acupuncture named Sugiyama Waichi. He's known to be kind of the godfather of Japanese acupuncture. And if you look through his school's work, there are hundreds of or it's not hundreds, but upwards of 100 needle techniques in that work. And, it's the full spectrum of depth, intensity, target tissue, what have you. There's so many different variations. And so there certainly exists, deeper techniques and muscular techniques and subcutaneous techniques, and in my part of the course I focus on those subcutaneous techniques as they pertain to that division needling that I've mentioned. Because again, as you might be well aware, that in clinical practice a lot of people do tolerate this kind of work and can really benefit from it. But there are some people who are not that tolerable, and would require a gentler type of technique. And there are also situations where you're concerned maybe about breaking a needle if the patient's really prone to spasm. And so you might want to employ a more superficial technique to avoid that danger. But division needling serves that role as well, is that you have a more subcutaneous or intermuscular, around the muscle type of technique to sort of restore the myofascial space, and to stimulate those structures to treat this hypertonicity. And so that's kind of what I focus more on in that course in terms of the array of techniques and discussion of physiology and this kind of thing, and anatomy and so on. All right, so if you've enjoyed this content, please like this video, share it with your friends. If I've made any mistakes, please let me know. But any mistakes are my own, not Huanglongshang or not the trigger point manual. So please point those out to me. If you have questions, please let me know. And if you're interested in learning more about this, head on over to the Academy of Source-Based Medicine and check out our Neijing Part 1 course, eventually our Neijing Part 2 and 3 courses, and be on the lookout for my book that's coming through Purple Cloud Press about the development of Jingluo or channel theory, how that came to be. But thank you for listening.